So Motherese is really great, right? And at least it seems to be really, really helpful. At least have a lot of helpful properties, right? And so some studies have looked into this, into how we can sort of measure the impact of speech directed at children. And it seems like child-directed speech really scaffolds lots of different knowledge. A study from 2014 found that children who listen to speech that's directed at them, really babies, honestly, promotes their acquisition of fundamental cognitive and social psychological capacities, right? Really basic components of not just learning language, but learning in general, learning about social things as well, that form the foundation for subsequent learning. Because as we have talked about and will talk about, the social component of language acquisition, the impact of the social factor is quite significant. So what kinds of things are we talking about here? Well, for example, babies who listen to speech notice patterns or regularities among the sounds or objects that surround them. They recognize partners with whom they can communicate, right? That's an important social component for language acquisition. They establish coherent categories of objects and events, an important conceptual thing, right? So this is some really nice effects of listening to child-directed speech. And in fact, if we look really early, just 24 hours after birth, in fact, the sound of a mother's voice specifically activates the language processing and motor circuits of the brain, more so than even another female voice, because this is the signal, right, that they've been hearing up, for the entire time that they've been able to hear in utero, right? So this is a really powerful impact of the mother's voice in particular. And children, in terms of, if we look at, again, measurable impact, children who attend daycare centers that have more one-on-one contact with an adult, so they're getting more of that child-directed speech, more of that motherese, they seem to acquire language more rapidly than children who get less, right? And older children who receive all of their parents' child-directed speech generally develop language earlier than later-born children who have to share that child-directed speech with their siblings, right? So getting more of it seems to be very helpful. And in fact, more recent studies have looked at coaching parents actually to use more motherese with their babies, with their 6 and 10-month-olds. Mothers who did this, parents who did this, ended up with 14-month-olds who produced significantly more words, and 18-month-olds who had much more vocalization, much more conversational turn-taking, and larger vocabularies, right? So just getting that child-directed speech is really very powerful, very effective. And we do know that 21-month-olds, right, just under 2, they learn new words better from child-directed speech compared to adult-directed speech, because it seems like there's something really special about words that are specifically directed at children compared to words that they just simply overhear, like the way that adults might talk to each other while the child's present. Words that are simply overheard tend to have very little impact, for example, on vocabulary acquisition until children are preschool age. And one of the reasons for this might be that the relative complexity of overheard speech is higher than child-directed speech. That is, overheard speech is more complex in various aspects linguistically than child-directed speech, and until children are about 2.5 years old, 30 months old, right? So they're hearing, again, we talked about that sweet spot of trying to get the right level of linguistic complexity for children to absorb information the best, and so overheard speech is probably not in that sweet spot most of the time until children are a bit older.